I want to ask a little bit more about your partnerships. Who are you working with? Because you mentioned some grants that you have and that you're working with different state offices. So can you talk a little bit more about that?
We get our referrals through Albany County and also through CPS. So we're constantly in communication with the county workers, sometimes with the CPS workers, and then also with probation, as some of the clients that we have are on probation. We've also worked with, I know we provided equine therapy for some of our clients. So we had a connection with an equine therapist and we're able to provide families with that opportunity. But it's you're communicating with a lot of people in the community, a lot of different family members, and it really gives you an overall, everybody's working together to try to serve the clients, the families.
Some of our other partnerships as well. We have a partnership with Warren County Department of Social Services, as well as Saratoga County Department of Social Services, Rensselaer County Department of Mental Health, and some others that I'm sure I'm leaving off right now. But I think the big benefit to these partnerships is that you can take a team approach to cases and, trying to help clients in whatever it is that their needs might be. So we're not all siloed out to one issue and saying, sorry, I can't help you with this other stuff. But we can advocate on our client's behalf with their caseworker and work as a team to try to get their needs met. And I think that's one of the big strengths about St. Anne's that, some other agencies are not able to provide. Unfortunately, it's sort of like, you come in for therapy once a week and that's your time and that's it. Whereas St. Anne's is able to take more of a big picture approach with families and, really kind of wrap around and, spend more time collaborating with the other services involved, with their caseworker, whoever it is that needs to be collaborated with in order to help this family move forward and, really tailor the services to the client instead of saying, hey, this is what we can offer that may or may not work for you. We can say, what do you need and how can we make this work?
So as supervising residential, we also work with our runaway homeless youth shelter. And that is a federal grant that we have. We have to reapply every couple of years, but we've had our shelter now for, I believe, about 5 years, maybe a little bit less. But with that, we provide therapy to the youth in the shelter. It is volunteer based. They're not obligated to participate in treatment, but if it is something that they want, they can have it. And that's a very different population. And I can speak to residential a little bit later as well. But that also requires taking a different approach. There's different reasons why kids come to the shelter. We work primarily with youth between the ages of 13 and 17, and then we actively plan with others in the community. Sometimes it's probation, sometimes it's the county mental health clinic, but because it's a federal program, we take kids from across the country. We've had kids come from Arkansas, Ohio. We were working with one youth who was supposed to come from Louisiana at one point. And we work with whoever the service providers are to either reunify and have that youth be safe going home, or we come up with an alternative program, which might be a transitional living program, whether it be local, out of state. But that's just another program that we work with as well.
St. Anne's is, I understand, again, I've been here a year, understand that St. Anne's had a strong relationship with NASW in the past, and we're re-energizing that. We're also working really closely with all of our local politicians. We work really closely with Senator Breslin, Assemblyperson John McDonald, Assemblywoman Pat Fahey, amongst others, the Albany County Exec, Dan McCoy. And so really working with our Director of Fund Development to make sure that St. Anne's is working collaboratively with our politicians to advance, our social service, social work agenda items. Just on Monday, we were I'm sure CAFCA, the Council on Family and Child Caring Agencies. We participated in Lobby Day, and so met with all the politicians to really advance the governor's budget. There's lots of things in Governor Hochul's budget that would really help social workers, human service workers, the COLA, the increase in the prevention services money, the foster care block grant money, the not-for-profit infrastructure capital improvement program. I mean, St. Anne's has been around, like I said earlier, since 1887. So, you know, our facilities really need modernizing. And as we're moving, I think the team mentioned earlier, with the work that's being done in the rural communities, telehealth capability and technology is really key. And so what we've seen, one of the silver linings of the pandemic is that it really forced human services providers to really, you know, really put telehealth services into practice. And so this group has done that. Our partners have done that. And I know the reports that I've seen, utilization is way up because it makes it a little easier for clients to be able to stay in touch and receive services if they can do them using their smartphones. But we have to make sure that we have the connectivity and the technology and the equipment to do that. So really taking a stance, not just on the national stage, like Alexa said, our runaway and homeless shelter services, that's a national grant. Tiffany's program, the OJJDP, that's national, that's got us on the national stage. And so we're really working to make sure that St. Anne's is a contender, and that we want to make sure that we're working really collaboratively with our politicians and to really, like I said, advance social service agenda items that are important to us to keep the work going, I know it always sounds dramatic, but I always say these are life-saving services, and that's not an exaggeration. They're life-saving services. And like you said earlier, we're bound by our social work code of ethics to make sure that those life-saving services continue and are accessible to the people that need them. So we take it very seriously, and we're, like I said, working really on the county level, the city level, the state level, and the federal level to make sure that, we're advancing those agenda items. So we also got reconnected to ACRC, the Association for Children's Residential Centers. We're also in a strategic alliance with St. Catherine's and LaSalle, but we also partner with Northern Rivers. Actually, Alexa and I will be attending a networking meeting with OMH, OCFS, Northern Rivers, LaSalle, St. Catherine's, and St. Anne's on Friday, as we're working together with OMH and OCFS to design a new type of residential program that's kind of in between an acute care setting, a hospital setting, and our QRTP. There's really, for a small percentage of the population, there are kids that don't necessarily need, inpatient hospitalization, but they need a little bit more structure and a little bit more support than what we're able to do in our QRTP. So, so again, those are just some of the, the strategic alliances, the collaborations that we are doing as social workers, but also as a social work agency. Like I said, at the city, state, county, and federal level.
I think, Richard, you bring up a good point about, that and that we're uniquely positioned at St. Anne with the residential and the outpatient to see those gaps in the community gaps, right? As Richard was saying, that there's that transitional piece, or that area that isn't being, addressed. And I think in the community, it's the same thing. More and more pressure is being put on the community to offer the services and the resources that people need, so that they don't go, so that they're not going inpatient or they're not going to residential. And so I think it's, we're really set up to have that unique perspective, as Richard was talking about these high level policies and the residential to the community. Tiffany is part of the grant for the federal grant that Richard was talking about, and she's in this really unique position because she was a new therapist hired to set up a new office with a new grant. So she's had some really interesting experiences, I think, with her community connections as well. So I don't know if she wants to speak a little bit to that.
Yeah, so through the Office of Juvenile Justice and Delinquency Prevention, got the grant. we have received training for problematic sexual behavior, cognitive behavioral therapy. And it's a treatment that we kind of follow and adjust it per individual. But it does have a 98% like effective rate, I believe. Tammy, correct me if I'm wrong. But so it is very effective, and we are seeing it work with the families that we're treating right now. And it is being reported to like other agencies, CPS, that they are finding it effective. But yeah, we treat kids 7 and older that display any kind of sexual behaviors. So that could be acting out on the internet, you know, sending inappropriate photos, using the internet to look up inappropriate things. Could also be touching or showing private parts to other people. Just kind of not socially acceptable behaviors for the age range that there are. But we work on, you know, emotional identification, learning relaxation techniques, sexual education. That's a big one that doesn't really happen in the schools. So it's always amazing to see what the parents don't know and what the kids don't know, and keeping them educated. So we do work with both the parents and the kids. So it is a family treatment modality as well, like Rachel said. And then we work on, you know, abuse prevention and what to look out for.
Thanks. Just to mention, Tiffany's been trained in PSB CBT, which is problematic sexual behavior CBT. So she's working towards fidelity. And we've also had Alexa and I and Richard have put together the motivational interviewing. So people have been trained in motivational interviewing. That's another area of that evidence-based intervention. So I just wanted to add that